Good afternoon, and or good evening, depending on where you're watching from. Thank you for joining us. I am Ellis Dean, the Director of Digital Programming and Communications here at blackdoctor.org. We are excited, and I want to say happy belated Christmas, Merry Christmas. I hope everybody had a wonderful holiday season. We're still in the middle of it. We got a new year coming up in just 5 days. I can't believe that. 5 days. We're gonna be in 2023. But right now we're still in 2022, and so we still have some great quality content program that we're going to deliver to you today. So if you haven't been watching us, and I don't know why you haven't been, we've been doing a series on Alzheimer's, right? So we've done, it's called Alzheimer's 101. We've been breaking it down. We've had some wonderful doctors on with our partnership at Cedars-Sinai, coming on and talking about all things Alzheimer's. So this is the final, and I think we've saved the best for last. I think Dr. Simpkins would that we saved the best for last for you today. And we've got Dr. Alexis Simpkins from also part of the Cedars-Sinai staff. She's MD, PhD. That means she's got a medical degree and a doctorate of philosophy, so she knows what she's talking about. And she's got a master of science. She's director of vascular neurology research and a director of the script program at Cedars-Sinai Hospital. So you know the sister is powerful and she knows what she's talking about. So today we're going to be talking about stroke prevention and vascular dementia. So please, couple housekeeping things we're going to do before I turn it over to Dr. Simpkins. Number one, let us know where you're watching from. We always like to know where people are watching us from all over the world. So drop that in the comments section. Give yourself a shout out, give your city a shout out. You can even say Happy New Year if you want to Dr. Simpkins, myself. We love those kind of messages. So drop that in the comments. Number two, if you have any questions, please drop those in the comments. We have time at the end of the program. We want to get your questions answered. So please drop those in the comments as well. And finally, if you know somebody that needs this information, that could benefit from getting this information, please tag them or share this on your page so we can get that word out, because we want as many people to get this life-saving or life-changing information as possible. So that's all my housekeeping thing. So I'm going to throw it to Dr. Simpkins. Dr. Simpkins, how are you doing today?
I'm good. How about yourself? I'm so glad to be here.
Fantastic. I am fantastic. I'm looking forward to watching this presentation. I know a lot of people are touched by strokes, especially African Americans in particular, because it's a direct correlation between high blood pressure, hypertension, and strokes. And so we know that the hypertension is disproportionately impacting Black Americans. And so there is a direct line. So please get your pencil and paper ready to learn about all of what we've got going on. So Dr. Simpkins.
Thanks so much. I'm happy to be able to share some information. And this is to help, provide enough knowledge so that people can advocate for themselves and their families to make sure that stroke and vascular dementia can be on the decline within our community. So I'd like to start off with just saying that I don't have any disclosures or any off-label medication use presented in this talk today. The things that we're going to go over are from neurologic disease, some of the things that have the greatest morbidity and mortality in Blacks and African Americans, and that means what neurologic disorders or diseases of the central nervous system or peripheral nerve system cause the most Blacks or African Americans to either have chronic illness or to pass away from that disorder. And then we're also going to talk about where we are within representation of this, how prevalent is this in comparison to other ethnicities and race groups. And then we're going to talk about ways of being able to protect ourselves. How do we prevent stroke? How do we prevent dementias? And then how do we advocate for ourselves and make sure that we have a seat at the table when we are trying to come up with new ways of treating stroke, preventing vascular dementia so that we can live our best lives. So first to start, this is a very important map here that demonstrates the concentration of neurologic disorders across the United States from 1990 up to 2017. And what you notice is that things that are highly concentrated, or there's a lot of it, is in red. Things where there's not so much of it is kind of sort of in the bluish range. What you note is that The things that have a lot of prevalence are migraines. Migraines have a lot of prevalence. There's a lot of stroke, a lot of dementias, and that there's a lot of concentration of things like stroke and dementias, particularly within the stroke belt in the southeast region. We have a lot of stroke and dementias that are important for us to learn how to prevent. Also, what's really notable, and this is presented from the CDC, is that if you look at the prevalence of things that are going to affect our ability to really enjoy our lives and have a good long continuity life of quality of life, is that we have more Alzheimer's disease, more prevalence of that than any other subgroup if you compare that between Hispanics and non-Hispanic whites. And the trajectory or the number of people who have Alzheimer's disease or dementia related syndromes are going to increase exponentially. So we're going to go from where we previously were, which was the prevalence of about 5 million people, and that's a lot, up to projected to be almost 14 million by 2060. And 2060 is not that far away. I mean, that's like 40 years from now. So that's not even quite like a full generation. So we really know that Alzheimer's is an important thing, that African Americans and Blacks are particularly susceptible to having an increased prevalence of diagnoses of this disorder within our population. Why that's important is that we now know that Alzheimer's disease has a connection with vascular dementia or vascular impairment, meaning blood vessels in the brain, when they are damaged over a prolonged period of time, that can increase the risk, or it kind of works in synergy with the problems that lead to a person developing Alzheimer's disease. So to break it down and even be more simple, is that if you're doing stuff to your body over time that leads to damage in your blood vessels, you're going to be more likely to potentially even either have Alzheimer's disease or to develop one of those spectrum disorders that are similar to that, like a vascular dementia. This is an MRI image here that I'm showing you of the types of damage that I'm talking about that can happen over time. We call this, and I'm going to mention some terms because these are things that you might hear when you go to your clinic office to see a neurologist, or if you see your primary care and you get some imaging studies done. This way, you know how to understand what they're talking about and how to advocate for yourself. So we call this white matter disease. And why is that? Because these are the neurons that are underneath the cortex. They're in the deeper structures of the brain. And when they were doing pathology many, many years ago, and they looked at the tissue postmortem, looked at the brains, they were like, oh, this part of the brain looks lighter than the top layer. So that was called the white matter. And when it has a disease over time, you can see that the tissue starts to die off and it becomes very bright because it was damaged. And so we're going to talk about how patients end up with this kind of problem, with these patterns of white matter disease that work in concert with the damage that happens with Alzheimer's that lead to cognitive problems or problems with memory, problems thinking, things that are going to impair your ability to take care of yourself independently. Vascular dementia is a significant cause of cognitive issues. Now, cognitive means their ability to think and process, the ability to be able to use your executive function to do simple things like remember tasks, learn how to organize your thoughts, to do simple things such as cooking, paying your bills. All of those things are important. You need your cognition or your brain function to be able to do that. Also, you need your brain to be healthy so that you can walk and do simple things like getting around and not falling, and being able to be independent. So these are really, really important things that affect quality of life, particularly as we get older, and have a combination of the pathology that could happen from potentially from patients who may be at risk of Alzheimer's disease, and then just adding this on top of it could be even more problematic. In addition to developing the dementia syndromes, the patients can also have an actual stroke. And there are two different types of stroke. One is when the blood vessel bursts open and blood can leak into out into the brain tissue, which is dangerous. That's called a hemorrhagic stroke here. And then you can also have what we call an ischemic stroke. Ischemic means there's not enough blood flow going up to the brain. So somehow an artery got blocked off, and because there's not enough oxygen and glucose or nutrients going to the neurons, once the blood vessel gets blocked off, there's not enough some nutrients going there and the tissue will die. And we call that an ischemic stroke. Having an accumulation of those things can also lead to a dementia. And while we've done a lot of good things on making sure that we have newer medications and ways of preventing stroke and ways of treating stroke, we still have a lot to do to prevent people from having effects on their quality of life as they get older from loss of brain function related to vascular dementia. Those things happen very commonly from stroke risk factors, which we're going to talk about. Different things that you can do to prevent your likelihood of developing any of these problems. And some of these things don't require any medications or any extra costs. It's just lifestyle changes. This is a patient who has mild, kind of tiny dots that you can see white, lesions that are scattered throughout within the brain matter. These are what we call lacunar strokes or ischemic strokes that are tiny and small. And if you accumulate too many of those, that you can also get a vascular dementia. The process that happens in the brain when you end up with these chronic sort of high blood pressure. So these are things we know that give us risk factors for stroke. So high pressures in our blood vessels that are way higher than what we normally would need to be walking around, and we may not even feel it. It leads to damage of the blood vessels that are in this area. So this is a map or a scan that shows what happens to the protective layer within our blood vessels and next to the neurons that keeps everything where it's supposed to be, keeps the blood in the blood vessels, keeps healthy nutrients going to the neurons. When our blood pressure is elevated and not well controlled, we can start to have some damage to that special lining. And that leads to inflammation over time and leaking. And the inflammation that you may not feel this, but it's ongoing when the blood pressures are too high, leads to that damage in the white matter disease that I was showing you. And this study that I conducted with my co-fellow, who was Dr. Gupta, who's fantastic, who's now currently working in DC, and my mentor at the time, which was Dr. Richard Lee, who is awesome and is now working still in collaboration with NIH and at Hopkins. We found that hypertension was particularly associated with this pattern of damage. And these are things that you do not feel, that you're walking around and you're like, well, I think I'm fine. I took my blood pressure medication for a while. My blood pressure went down, so I guess I'm fine, right? Well, no, not necessarily. All of these risk factors and things like that that we talked about being in association with needing to protect ourselves from developing problems in vascular dementia, the hypertension was the one that had really the strongest association with having damage to that protective layer that you need to keep in mind and make sure that is protected, even if you're not feeling any symptoms. Once you start feeling symptoms, you're now in this neck of the woods. We're now in the neck of woods of actually having stroke. And symptoms or being close or threatening to have one. And these symptoms that we're talking about include loss of function of your arms, legs, speech, your vision, uncontrolled headaches or extreme headaches. These are all signs and symptoms potentially of stroke. And stroke is the leading cause of long-term disability in adults. What does that mean? That means that as the leading cause for a person to no longer be able to independently take care of themselves long-term, the cause is from having a stroke. And there's many things that lead to that, but I still will harp on one of the most common things again, which is the high blood pressure. And there's a lot of other things that will influence, how we move in society and things like that, that can control how well we're able to keep our blood pressure under control. So things such as stress, things like having health access to healthcare, having, funds to be able to get affordable medications, a healthy diet. Those are things that do factor into things, but there's a lot that we can do that's within our control that we've got to advocate for so that we're not continuing to top the charts on things like stroke and dementias.
So, quick question, Doc. Help our audience understand what's the threshold for being hypertensive or having high blood pressure.
So it depends on each kind of, sort of which study you look at and what the guidelines are. For sure, a normal blood pressure is 120 over 80. Now, the numbers of exactly how tightly someone will want the blood pressure to be may depend on your kidney function, whether you have diabetes. For sure, I think, every adult should start with doing a simple thing such as going and getting a blood pressure cuff so that you have it and just start tracking to see what your blood pressures are on, a frequent basis rather than just relying on going to. I think one of the most problematic things that I see is that a patient may rely on only showing up to the primary care doctor and having that annual visit to be the only way that they're diagnosed with hypertension until have come in and they've had a stroke. It's as part of self advocacy and taking care of ourselves. Once you start, you're an adult and you start um, uh, having these routine appointments and you see that your blood pressure is on that borderline or slightly above, the 120s, 130s, definitely the top number 140s, you need to start checking your blood pressure on a regular basis yourself and keeping a diary of that so that you can take that to your primary care physician and discuss, okay, how my blood pressure range has been in really high. How, I know that that's too high. It's not a normal blood pressure. I don't feel comfortable with that. How do I work on getting this blood pressure under better control? And sometimes it's medications, and there's lots of medications. So if you have a intolerance to one, something that's, you have a side effect from one, you're not having you feel bad when you take a particular kind. Best thing to do again is about self advocacy and just getting another anti blood pressure medication because there are several of them out there. Because you don't want the version here where it's in the green box where the artery bursts open, you have an intracerebral hemorrhage, and you don't want to have those high blood pressures are constantly beating on the blood vessels and leading to damage and inflammation, and that leads to the artery blocking off and having ischemic stroke. It's just like you would not turn the garden hose up super high force and just continue to let it be going super high for prolonged periods of time because you know that that's going to mess up your garden hose and you don't want to do that to your body. So this is super duper important. And we'll talk a little bit more about these blood pressure numbers and things like that too in some of the other slides. Blood pressure is big. Also, cholesterol control is big. All of these things are super important. Your diet, how active you are, whether you have a sedentary lifestyle, going and also getting routine checkups to make sure that everything is set. We take the car for a routine checkup. We have to also go to our primary care physicians as a first stop to make sure that we are getting all of the routine medical care that we need to make sure we have good long health care and longevity. So high blood pressure I've harped on quite a bit. It's also important to make sure we're sleeping well. So sometimes, um, especially if you are snoring at night, you're having episodes where someone's kind of nudging you because you've had these apneic kind of sort of episodes while you're sleeping because you're snoring so hard. All those things aren't good. Sleep is important. The blood pressure is important. Also, the diet's important. Everything that we eat and the quality of the food that we eat influences how well that our body can function. It's just like if you have gas in the car. For a car, you wouldn't want to put the wrong kind of gas in the car because it won't function. And over the long period of time, even if you don't feel it right away, if we are not eating good, nutritious foods, or we're eating in excess, it ends up creating a lot of inflammation in the body and can help be the cause of why that blood pressure is going up. So eating a healthy diet is super important. Also, it's key that we have to stay physically active. Our body is not designed to sit sedentary for long periods of time. We're, made to eat a balanced diet and to be in motion. So exercise is really important. And that also helps to make sure that people are connected with others, with family and friends. Isolation is doesn't help a lot with making sure that we keep healthy neurons. We need to constantly be, motivating ourselves and making sure that we are communicating with other people and using all active sides of our brain. So stay connected with family. Talk about your blood pressure with your primary care. Get good sleep and eat a healthy diet. So the blood pressure. So I've got these two graphs up here, and I want you know for people to just sit and think and look at this blood pressure meter here. So this is what you'd see when you go into the clinic, and someone may ask, well, which one of these blood pressures do you have when you go to clinic? Hopefully, it's this one down here, B, that the blood pressure is right around this range. And I hope that the blood pressures are not in this range. If you are having blood pressures that are high, definitely if they're above 140, and even that goal sometimes depending on the patient, the blood pressure goal may be even more strict to be less than 130. But for sure, if you're getting above 140, that's a problem over the long term, leading to damage to the blood vessels. They don't like to have those kinds of high pressures on them long term. And you don't feel it because the blood vessels don't have nerve endings in them. So you're not going to feel it until the blood pressure is so high that you're now have put an end organ, one of your organ systems are getting ready to have a problem or about to fail. And that's when you are really in a severe, severe state. So you don't want to get to that point.
Now, Doc, correct me if I'm wrong on this one, but I learned this while watching one of our programs, while hosting one of our programs here, is that the systolic is when the heart is beating,
Yes,
and that's the top number, and then the diastolic is when it's between the beats.
correct,
Okay.
correct. So you get tuned when you are checking the blood pressure. If it's an automatic machine, or you go to the clinic, or you go to a local pharmacy, there's two numbers that you'll get. You'll get the top number, which is when that heart is contracting, and then the one that's in between the beats is the diastolic. Both numbers are important, particularly for stroke. The top number is very important, and for cognition. So the next thing we'll kind of segue to is, what about, like, you say, hey, doc, I've done everything that I could, and I just got a facial droop and my arm and leg is not working. Now what? I mean, I tried my best and this still unfortunately happened to me. So because strokes or accumulation of multiple strokes can lead to a dementia, it's also important to know how to advocate for yourself to make sure that if this unfortunately happens to you, that you can get this treated right away as quickly as possible. Because there are things that we can do. There's things that I do for patients on a daily basis whenever I'm on. That's my job, is to go in and save brains so that we can get patients back to their lives and not having or as having a small amount of disability as we can possible from an event if it unfortunately happens. So first thing is to make sure that you recognize the stroke signs and symptoms. So fast are two ways to help remember stroke signs and symptoms so that you can get to the hospital as quickly as possible. So face, arms, speech, time. B is for B for balance, E for eyes. So loss of any function. Sometimes you can have headache, but stroke is can be pain free. You may not have pain. You just may lose function. And that's not the time to say, I think I want to Google, why is my arm not moving? Or you know what? My face is drooping to the side. Maybe I should call the nurse number from my insurance company. That's not the answer. It's always to call 911, because when you do that, you activate the system that is set up and designed to take care of you as fast as possible. So this is a picture here from some people that I used to work with at Washington Hospital Center in DC when I was doing my stroke fellowship. So when you activate that system, you have activated EMS to come pick you up as quickly as possible. They call the hospital, let us know you're on your way, and we're down there in the emergency room to meet you, to get you to the scanner. We have time metrics to meet, and we want to get patients treated as quickly as possible. So it's important to, if you develop stroke signs or symptoms, don't wait, don't think on it, don't sleep, don't go to sleep on it, to activate the system that's set up and designed to protect you.
Now, Dr. Simpkins, is this a sudden onset of these symptoms, or is that a over time? Uh,
It's very much, if things happen acutely, all of a sudden you have something to happen.
gotcha.
Sometimes people can have a stuttering course where, they get a facial droop and have slurred speech and aren't able to talk. It lasts for 5 minutes and then goes away, and then maybe it comes right back again.
Okay,
Call 911.
gotcha.
That's what we're here for. We're here to figure it out for you. So here's an example of a patient. So this 54-year-old woman, she was a smoker. So that's something that definitely, I bring this up because this is another thing that will actually save you money and make your health better. So if someone is smoking, if anyone's smoking, it does damage the blood vessels. So it's a great way to work on doing stroke prevention, primary prevention for cognitive issues with no cost. And she also had high blood pressure, and she had high cholesterol, and all of a sudden she could not move her right arm and she could not talk. So the thing to do again in this situation is to call 911. Another reason why it's so important is because there are guidelines or national guidelines that are set up, because this is such an important thing that we get as many patients treated as we possibly can. And this is directed by the American Heart Association and the American Stroke Association to make sure that we're providing the most optimal, highest level of care for all patients that present with acute stroke or are activated through EMS. We know that it's important that the community is educated so that we can get people in as quickly as possible, because that helps to shorten times that we can get therapy to a person who comes into the emergency room. The faster we treat, the better the outcomes. If you sit in triage because you walked in or someone drove you in their car and you sat waiting to get to the front desk to tell them what your problem was, you're just delaying treatment for yourself. So it's that you're not advocating for yourself if you do something like that. We have systems of care, again, that are set up to do three things really: stabilize your medical condition, so your vital signs and things like that, and also to, if needed, to either give you something to break up a clot or to pull out a clot if you happen to have one that went up and blocked off a vessel. We know that stroke signs or symptoms, being the awareness of stroke signs and symptoms can vary by patient population and area. So it's important that you educate yourself on these things if no one else is doing it, to make sure that you know how to advocate for yourself or a bystander or a family member or someone else if something like this were to happen, to help bridge that gap, bridge the disparities for healthcare. Knowing stroke signs and symptoms or not knowing stroke signs or symptoms can make the break a difference between someone doing well versus someone not doing well. And it's important to even consider that language barrier should also not play a role. Any stroke signs or symptoms, don't trivialize it. Don't sleep on it. I just want to re-emphasize that. Make sure that you call us and contact emergency services so that we can help. And that includes for people who are even in the hospital. So most of the information I was presenting was like if you're at home or in the store or at work, And a stroke can happen anywhere, unfortunately. But even if you're in the hospital, advocate for your loved one if you notice something is different. Patients who are admitted are often have a lot of complex medical conditions and are at higher risk because of that, of having stroke. So if you notice something, you know, always make sure to be the best advocate for your loved one. And this again goes back to I just wanted to convey that the EMS, when you call and activate EMS, they're trained to pick up on stroke and stroke severity, and they have multiple scales that they use to help assess quickly, to help it communicate with the emergency room and the stroke physicians that are at the hospital. So we are communicating back and forth. It's just important to make sure that you call them so that they can use these tools that they're trained to use. So other things that you might see, just so that you're aware of what we have to offer, these new things that are available, is that even if you go to a hospital that doesn't necessarily have a neurologist there all the time, if they're a stroke ready hospital, they may have a physician available through telemedicine. So we video conference in and do examinations on patients remotely through the computer robot, and can help get patients clot busting medications and coordinate care when needed to help remove a clot if needed. We are able to screen patients for acute therapy, even if for some unfortunate reason the person woke up with their stroke signs and symptoms. Again, don't go to sleep. And if you have stroke signs and symptoms, still activate. But if for some reason you happen to wake up with stroke signs and symptoms, still call 911. We have the capacity of being able to screen, to time a little bit better the onset of stroke signs or symptoms using MRI technology to do that. And we also have the ability of using advanced CT imaging to help us to determine in longer periods of time how safely we can go in and remove clots now. So the important thing again is to call 911 so that we can be there to take care of you. Okay? There are two different types of clot busters that we have available now. So before we only had one. It was called tissue plasminogen activator, or TPA. We also have a new one called tenecteplase. So you may hear one of those two medications, just in case if you have the unfortunate bit that you end up having something like this to happen to yourself or a loved one, just so you're aware of those two terms there. And then we also have some antiplatelet medications to use, and we have special blood pressure management that we use in the acute setting that can also help. This blood pressure goal, this is not for your routine everyday care. This is for specifically if a person is admitted to the hospital and we are doing specialized stroke care under the supervision of a neurologist, a stroke trained physician, or a neurocritical care trained physician. So
Now,
let's,
Dr.
yeah.
Simpkins, we have a question from the audience, and from one of our YouTube watchers. And she asked, "Can taking aspirin during a stroke help?"
Depends on the type of stroke. So remember, I said that there were two different types. There was one when the blood vessel bursts open. That's a bleeding problem. So we wouldn't want to take anything to thin the blood out even more. The one where a blood vessel, let's say the blood vessel is blocked off, if it happens acutely, again, don't think about aspirin, no aspirin, think 911. Because if you have an acute blockage of the blood vessel and you're eligible to get one, either tissue plasminogen or tenecteplase, they are way stronger on a huge scale. Aspirin isn't enough to do the job at that point. We need something that's much more powerful. You don't want to go in if you've had an acute stroke and the blood vessel is blocked and take something that you could get at the pharmacy. You need something that's going to be strong enough to actually do the job, and that would have to be administered under the guidance of a board certified vascular neurologist. And that's why it's important to call 911, and you let us help you to decide which one you need to take. Sometimes patients are not eligible to get these clot busting medications, but things that are going to make it more likely is if you come in as quickly as possible so that we can do our job. So this is what happened with this patient. So she came in right away, called 911, and we found that she had a blockage of the artery here. This is her left side, this is the right side. And because she came in right away, we were able to administer thrombolysis to her. At the same time, we were able to do a clot retrieval procedure where we went into the interventionist went in and deployed a device that trapped the clot and pulled the clot out of the brain. And again, these are things that this is not something that you're going to be able to fix by going to the pharmacy or taking your local aspirin. This requires advanced level care, which you will get with the lights and sirens if you call 911 to get to the hospitals right away. After the procedure, the blood vessel was reopened, and she came back to her appointment and telling me she was doing great and she was able to return to work. So we got her back her quality of life, and she worked on making sure she was controlling her stroke risk factors. She stopped smoking. She got her blood pressure under control, and she took her medications for a secondary stroke prevention. So we talked a lot about the different types of strokes. So intracerebral hemorrhage. So this is when, again, when the blood vessel bursts open. So you can see this little picture with blood in the tissue of the brain. It is also important to make sure you get to the hospital right away for management of this. Why? Because we want to try to do everything that we can to get control of that bleeding, whether that's that you need blood pressure to be lowered right away. And we would need to do that potentially even with IV medications, making sure that we protect the other organ systems if there's other organ systems that can be involved, because a stroke is incredibly a stressful event and can lead to other complications. It's important to make sure you get to the hospital right away for these life-saving things. And sometimes you might even need a procedure to help, remove some of the pressure with that space of with the blood taking up space in the cranium when we only have so much space there. So 911 is the thing to do um, with any kind of stroke signs or symptoms again. So now we talked a lot about the things that we can do from a medication management, hypertension, blood pressure control, diet, exercise, take your medication, see your primary care, advocate for yourself in that way. But there's other things that I think that are also important that I want to just kind of end on, because it gives some perspective on what we can do as a community to help advocate for ourselves. So I'm going to go back a little bit in history and talk about a little bit about where we kind of have started from some of these things and where we should probably be thinking to go in the future. So this is a picture of Dr. James McCune Smith, and I put him here because he's one of the first African American men to obtain a medical degree. And he got his degree from Glasgow University in 1837. So 1837. We talk a lot about healthcare disparities. You see a lot of news talking about healthcare disparities and things like that. But this is not a new concept. The first, or at least to my knowledge, the first published article talking about healthcare disparities uh, was published by him in 1846. And he published this article. The picture's very grainy, so I apologize for that. I couldn't get one that was more clear. He talked a lot about the stress and things that uh, people of African descent in the United States at that time um, were enduring, and how that influenced longevity and influenced morbidity and mortality in patients of African descent. And we're still kind of talking about the influence of uh, the way that the systems and structure uh, can influence one's healthcare and outcome. So it's important to think, to be at least aware of the consciousness that this is something that we have to constantly be working on to try to move the needle, and that there's a long-standing history of documentation of how one's life journey can influence their health care. And so coming up with different ways to manage stress, coming up with different ways of honing in on one's wellness and advocating for yourself, knowing what you need to do to protect your health is is super important, because you have to take the bulls by the horn and do it for yourself. No one's going to advocate more for you or be able to uh, make a person take medications or consistently follow through and make sure that their blood pressure is well controlled other than the person themselves. And um, there's evidence that all of these things are super duper important. We're going on, what is almost 200 years now of knowing that it's important how we walk through life and how it influences how we show up in the clinic and how we show up in the office, a physician's office, and how those things need to be taken into consideration so that we meet everybody where they are and provide them with the best health care possible. And part of that is by giving yourself the knowledge that you need to advocate for yourself so that you get just as good care as everybody else. Another person that I'll mention to you is Dr. Fuller. Dr. Fuller is not really often talked about, but he immigrated from Liberia. He was an associate professor at Boston University, and he was one of the authors on one of the first case series of what we now describe as Alzheimer's disease. And he was actually the acting chairman of neurology at Boston University. So a lot of these discoveries and things like that were influenced by the things that we talk about now have a great contribution from people of African descent. So this is really super important that we continue to push the needle for ourselves and for all of that they sacrifice to help people like myself and for others to be in a position where we can try our best to push the field forward. In 1910, the Flexner Report came out. So, and I mention this just so that you have understand the context of we have had all of these wonderful findings and contributions very early on, but I know that many may say that they may not see as many physicians who reflect a similar background to them. Part of that influence of the Flexner Report is that there were many schools that were closed that were training particularly Black and African Americans at that time, for whatever reason. And one can always look at the Google and look up the Flexner Report and read that for themselves to read and see exactly what their intent was when they closed those schools. But the consequence, regardless of the reason, the consequence is that we have way less people who are graduating from medical school who are Black or African American and going into neurology. So this is a model. This is from an article that's published in JAMA that shows that we potentially could have had 35,000 or at least 30,000 approximately more trainees graduating from medical schools had we had a similar number of medical schools that were properly funded and were meeting, appropriate metrics. So that leads to a lack of representation. And this gives an example of gaps of representations of Black and African American trainees in neurology in particular. So you can see in this trend here, this line, the bottom line, I guess this is almost kind of like a lime greenish color here, that there are very few and far between, Black or underrepresented groups, particularly going into fellowship training in neurology, which is what we need. We need people going into neurology to study stroke, to study brain function, to study dementias. And there's been some attrition in that. And this is from 2006 to 2018. And in particular, when it comes to stroke itself, this bar down here, so this is 0. This is 10. So we're looking at somewhere like maybe 3, you know, and this is the number of people who've done ACGME certified, stroke fellowships per year from 2006 to 2018. So there's not a lot of representation, and there's things that we could do to kind of bridge that gap. And I think we all have a responsibility of doing those things and going back to what these people like Dr. Fuller, Dr. Smith were trying to advocate for, to help bridge that. So here are some representations of neurologists in pop culture. There's not very many. We have Sidney Poitier in the 1950s. You have Omar Epps. Dr. Benson was one of my prior mentors, was in a documentary called Teachable Moments about stroke and stroke survivors. We have had movies about concussion or the TBI injuries. Dr. Williams is very visible in stroke prevention. We also have our Dr. Williams, who's very active on the Black Doctors org with the and her own sorts of social media realm with the nerdy neurologist. But there's not a whole lot of
We love Dr. Mitzi. She's fantastic.
yes, there's not a whole lot of other representation there for people to look and see what it is to be that we do exist, and that there's that's a career option for them, meaning kids in general is what I'm talking about.
Right.
Younger people who are coming up. And when you look at this, is just was just published not too long ago, maybe about a month or so, or yeah, so published in June of 2022. We're still in 2022 now. That the number of the proportion of high complexity stroke centers is lacking by the population of and when you look at particularly Black groups. So here's the graph here that kind of demonstrates that. So if you have areas that have a higher population of Black people living in them, there's not a whole lot of, you know, high specialized stroke care in those regions. So we have to do things to, you know, help make sure that we are feeding the pipeline so that there are people that are trained to more people trained to treat and help guide people like, to live healthy, long lives and great quality of care. There's a lot of things that are being done to try to help with that, building that pipeline so that we have more people educated to go into stroke, to go into aging and dementia. But it does take everyone. It takes community engagement. It takes you know, people helping to support through funding, sponsorship, mentorship, building programs that can help with bringing noting letting people know that this is a career option that's great to choose. I mean, I get to do wonderful things every time when I'm on service and help people get back to their lives. But we have to get the word out, and we have to make sure that people feel welcome in the arena of neurology, and support those who have interest in that. This is just a table that gives some example of different programs that are available. I'm just putting this up here for anyone who thinks they might have an inkling and want to go into neurology, or just say, maybe I'm interested in medicine and I want to learn more about what's out there to support me. Please, you know, go to the paper. There are all of these different programs that are available. There are people who are doing more local, regional things to help support people who are interested in stroke and cerebral vascular disease from a local kind of arena. I had a program myself that I built at the University of Florida before I came to Cedars-Sinai. There's lots of programs out there. We want to have people involved. The National Medical Association is very active, and we're wanting to, you know, help mentor people who want to go into the field of neurology. And so this is particularly for people who are going to school and or may have an interest in wanting to go to medical school, but it doesn't just start with that. You know, it's even earlier than that. We have to start educating all the way in childhood, you know, about healthy diets, about brain health, about life and longevity, because you know, whatever is the building foundations for the palate, the building foundations for a healthy lifestyle starts with what is implemented in a child's life. And I think that there's room for teaching kids this information. They learn so much so quickly. So we can, if they can learn songs and music and, you know, how to read, write, and math and all these other wonderful creative things in school, they can also learn about healthy lifestyle and making good options for themselves. There's lots of examples of things like that from multiple. A lot of institutions have children's stroke education. This is all this information is from the American Heart Association, but there's lots of information about how do I educate one, you know, not only the, you know, the adults, but the children about living a heart healthy life and recognizing stroke signs and symptoms so that, you know, we can all live to our longest days with all of the brain function that we need to have fun and do things like we just did, which is enjoy the holidays and, communing with one another. So that's all the slides that I had to present. I love to take any more questions. Hopefully that was helpful information for people. I really just want to empower people to help them to navigate the healthcare system, to advocate for themselves, and know how to protect their brain in the long term so that you can live a long, healthy life.
You know, Dr. Simpkins, thank you so much. That was fantastic. I love the fact you brought in the historical aspect and brought it forward on that piece. And I think I want to kind of crystallize it a little bit for our viewers when you're talking about kind of the lack of adequate care in underserved communities. And when you juxtapose that against uh, also food deserts, that are in community, and then you have lack of care. There's a lot of highly processed foods, a lot of foods that are
Mhm.
high in salt and preservatives. Those things that can increase our blood pressure, those things that make it harder for us. That can be a deadly combination, and I mean that very seriously because you're talking about putting in the wrong foods and then not having adequate care there available to you. You can see how when you put up that earlier graph about those areas, particularly where there's high concentrations of African Americans, we tend to reside more in the southeastern part of the country. You can see why those parts of the maps were red, because that's what you're going to get. And so we have to be diligent. And so when you're talking about self advocacy, that's why we do these programs like this, so people can get that information and say, you know what, even if we have to find a workaround, while we're trying to change the layout of our communities, we do have to recognize, what the challenges are, and the more we can recognize them, the more we can avoid them.
Right, right. And self-empowerment, because there's multiple ways to tackle things. We're all working to try to make the system better and more equitable. And that I think is hugely important. And then what works in synergy with that is when you're well informed and know how to say no. That 100, I know you told me that that systolic blood pressure of 150 was okay, not to worry about it. I know that it's not okay.
Right.
So I need that blood pressure medication to be increased.
Right.
So those are, and with that comes the, having the knowledge, or to even say, you know what? My primary hasn't changed my blood pressure medication in the last 3 visits, and my blood pressure's been in like the 160s each time. Maybe
Right.
I need a different person to see, to who's going to be attuned to understanding how important it is that my blood pressure is under good control, because I know that stroke and cognitive problems are an issue with my and with either within a family or in my and within my community.
Right.
So it's about, until we can get a perfect system, which we are constantly working to try to make the system equitable. Uh, Part of working in synergy with that is knowing when something's not right, so that you can advocate and say uh, that's not right. That's, I need to actually have a better blood pressure control. Or, you know what, my primary hasn't said anything about my weight, and my BMI is way above normal, and I need some help with this. So how do I find someone who's going to be attuned to my needs, or let me see if I can find another person that's going to help me meet these specific goals. So mm, for sure, the system needs to be better. And part of knowing when the system is failing you is to know when things are what you really need to have.
Right. Yeah. Don't rely so much. I mean, you're working in partnership with your medical provider. You're not just being, letting them tell you how to be. So if you say, hey, look, I saw this, I read this, I watched this program, doc, I'm consistently in the 140s, pushing 150 on my blood pressure, but you're not changing my medication, or we're not talking about doing anything. Why is that? And then
Right.
if they don't question, you can just ask why, and then let them give you their reasoning. And even if you don't, if that does not come with you, you can always seek a second opinion. You're not, beholden to one particular opinion. You can get other opinions. Speaking of which, and you brought up a good point in terms of obesity, because there was a comment earlier that talked about a lady said that her son has had his blood pressure, his systolic at 145 since he was age 16. He's now 23, and he hasn't had any treatment. Um, Without getting into specifics, because I know this is all just kind of in a generality, but
Right.
could that be tied to the fact that there's some obesity? There could be some other factors as to why they're not treating the high blood pressure, even with it being 145 at such a young age.
Well, so all this is just there are special situations where a blood pressure goal may be slightly different, and that's why I gave the caveat earlier when you asked about a particular number. So there could be a special reason why they don't want to do that, but want a tighter control. But the key is that, you know, um, your provider should be able to explain why they're doing what they're doing and what the long term goal and the trajectory is. That, hey, your blood pressure is this, but I'm letting it be in this range because of this medical problem, and this is what the follow-up plan is going to be for that. Uh, uh, it's always important to try to have to consider your labs and healthy weight and all of that when we're, you know, considering stroke prevention, prevention of cardiovascular disease in general. So having a healthy weight is one of the key things or key components of that. That is going to be individualized for the person, their height, and uh, abdominal girth, and all. There's a lot of different factors that go into that. And that's why it's important to have a primary care. You don't want to depend totally on uh, just information off the internet and things like that. Everything has to be taken into context, but you should be able to have a conversation with your provider about what the goals are specific to you, and if they're not doing something that fits within the standard of care, why they're doing that and what the follow-up plan is going to be. For sure, not having a sedentary lifestyle is important.
Right.
Um, make adipose tissue deposition, so having a lot of abdominal fats can lead to inflammation that can be problematic in the long term. And we're again talking about how to prevent problems that end up kind of, sort of, so to speak, putting rust in the pipes. You
Yeah.
know, it's very difficult to go back and, fix a old house with, worn out pipes or rusty pipes, per se. You'd have to repipe the house, right? Or we put new pipes, but we don't know, we can't do that in the body. So we have to just protect what we have, and that's over the long term. So that's from childhood all the way up to live a healthy lifestyle, and the caveat of depending on whether there's special medical considerations for each person, and
Right.
that your primary should be able to tell you exactly the reason why they have a specific goal and what the follow-up plan is. You should not be in a situation where you don't understand where you're going. It's like getting in a boat and then or getting in a car or something and having no idea where the destination is on the other end.
So there have been a couple of and people ask questions all the time about diets, right? What can we eat as diets? And so there have been two diets in particular that have come up multiple times when it comes to trying to keep your blood pressure under control, and that is the DASH diet, and that is the Mediterranean diet.
Mhm.
Uh, are those something that you talk about with your patients, and is that something
Yes.
that people should start having a conversation with if they're in that borderline or in high blood pressure range? Should they be having those conversations with their healthcare provider in terms of helping them low
Yeah,
pressure?
absolutely. Because there's a lot of different diets out there. I mean, they come and go like rain, right? You know, um, the the Cliff Notes version is our bodies are designed to function with a certain level of vitamins, protein, healthy fat, and healthy starches.
Right.
It's like a fuel. It's fuel essentially. So
Right.
if even if it's perceived healthy, if we eat in excess, that's not necessarily ideal. And if we put in too much that the body doesn't need as far as like a fuel, then that's not ideal. Mediterranean diet and DASH diet in particular are great for cardiovascular diseases because they help people to have a diet that is tolerable for the most part, because it's not super massively restrictive like some diets are, but still keep healthy proteins, still keep healthy level of vitamins that you need and healthy fats that you need. Um, and so and trying to exclude some of the excessive salt that can drive blood pressure up.
Right.
All of these things, still you need your primary care physician. You don't want to try to navigate all these things by yourself.
Right.
So because it's important to make sure that you're not on any. I would say that the biggest caution is if there's a diet that's making you be super duper restrictive, where you are missing major items or nutrients that you need to function, then that should be a red flag that that's probably
Right.
not the most ideal things. And then also too, diets where you're eating in excess of something that is not, doesn't provide a great balance. So some of the fad diets that are out, or well, I guess maybe they're not bad per se, but some of the diets may have a lot of fatty content with trying to help people to lose weight, but all that fatty content can be problematic, particularly for a person who has had a stroke or cardiovascular disease, because all that extra fat just gets stuck to the blood vessel walls and again leads to heart attacks and stroke.
Right.
So Mediterranean and DASH diet, when you compare them with a randomized clinical trial, are the ones that are shown to be the most effective for cardiovascular disease prevention and healthy maintaining a healthy weight. It's always best to go with the evidence. Um,
Always say so. So definitely look those up online, and we also have some programming with our program that we do with Dr. May, Dr. Monique, and it's called Veganish, right? And so and she does a whole breakdown of all those different diets and the benefits as well as the downsides on that. So you can find that on our video Facebook page or on our YouTube channel. I will say just kind of, and you've touched on each one of these components throughout the program. So I want to kind of, summarize it for our audience real quick as we're wrapping up here is what you eat. And you put bad food in, you're going to get bad outcomes. This is the way it is. Like your car, you put bad gas in, you put bad oil in, you put bad anything in, you're going to get bad outcomes, bad output. So you make sure you eat right. You've got to move, and moving is not exercise per se, but you can just walk. You can vacuum the rug with vigor. You can go up and down your stairs. Dance. That's movement. Have some cardiovascular movement. So I'm not going to call it exercise per se, but some sort of movement. Thinking, how you think, it controls your mood. Mood control. So if you're talking about you got to reduce stress, how do we reduce stress? You gotta, I always say I got to protect my peace. So some things I got to cut out. Some things I got to let some people go. If they're disrupting my peace, I got to let them go. 2023, get your list together, cut some people, cut some things out, protect your peace, because I'm being funny, but it really is when we're talking about raising those cortisol levels, raising that adrenaline level, when people really get you underneath your skin, that causes that nasty inflammation, and that can have a hard, time in your body. And then finally, so we kind of eat, move, think, and sleep. Sleep is vitally important to our overall. Sleep is when your body refreshes itself. It replenishes yourself. Let your liver go to work, flushing things out. Let your kidneys rest from all that stuff that you put in. Let your body flush out. Helps your brain refresh. We got a neurologist here. We know sleeping, a normal adult, 6 to 8 hours. You have to go through that REM cycle at least twice per night. So you can have kind of refresh your body and be ready for the next day. And I know we wear it as a badge of honor. Oh, I'm only walking on 3 hours of sleep. I'm still working. I'm still late. You're really, really damaging your body. Get your sleep. Naps do not count. I learned that the hard way. Naps throughout the day do not count. So you can't take a 2-hour nap and then sleep 5 hours a night. That doesn't work that way. So you got to get consecutive 6 to 8 consecutive hours of sleep. So if you remember those 4 letters, eat, move, think, sleep, EMTS, those 4 things will help you be better, overall healthy, and then you can work in partnership with your healthcare provider.
Yeah, absolutely.
So I want to say thank you to Dr. Simpkins for a fantastic presentation. Thank you to our partners at Genentech for sponsoring the series on Alzheimer's, and also thank you to our partners at Cedars-Sinai for providing great presenters like Dr. Simpkins here. We have Dr. Tan and a few others I'm drawing a blank on right now, so I apologize for that, for coming on and doing a series. The series will be available. You can get the whole playlist on our YouTube channel, and you can also go to our Facebook page on blackdoctor.org to go back and watch it. And I go back and watch it. It's all about Alzheimer's. We've got Alzheimer's 101. What's the difference? We understand that dementia is the umbrella. Alzheimer's is it's a part of dementia, not the other way around, and so many different other things outside of that. But take care of yourself. Have a happy new year. If we don't see you, if you don't come back anymore, have a happy new year. Blessings to you, Dr. Simpkins. Thank you so much. And thank you all for watching. Y'all been fantastic in the comment section.
Thank you so much.